What I'm about to tell you could save you from a fall, a fracture, or a 2 a.m. ambulance call. Because there is one specific time of day when that little blood pressure pill, the pill you've been taking faithfully every day to protect your heart, can quietly become the most dangerous medication in your medicine cabinet. Especially if you're over 60 and you ever get up at night. I'm not going to make you wait 20 minutes for the answer like everyone else does. Here it is. The most dangerous time to take your blood pressure medication after 60 is right before bed, especially if you take a diuretic, and especially if you wake up at night to use the bathroom. That's the headline. Now I'm going to tell you exactly why, walk you through the 5 specific scenarios where bedtime dosing becomes risky, give you the simple safety plan you can use this week, and close with the 5 questions you should bring to your next doctor's appointment. Stay with me. What I'm about to tell, you could change the way you take your medicine for the rest of your life. Let me start with Eleanor, because her story shows the danger better than any textbook ever could. Eleanor was 76, sharp as a tack, organized, independent. The kind of woman who kept every medication in a color-coded weekly box. Her daughter loved that about her. Her doctor appreciated that about her. Eleanor took her blood pressure pill every night at 10 p.m. like clockwork. Never missed a dose. Never ran late. Never forgot. She believed that made her the perfect patient. Then one night at 2:17 a.m. she got up to use the bathroom. 3 steps into the hallway, the room tilted. Her knees buckled. She hit the wall, then the floor. Thankfully, she survived. But she fractured her wrist, and she never forgot the fear. What caused it wasn't a stroke. It wasn't a heart attack. It wasn't even a medication error in the way most people imagine. It was timing. More specifically, it was the dangerous interaction between bedtime medication, overnight blood pressure dipping, standing up too fast, aging blood vessels, and a dark hallway at 2 in the morning. And here is what makes this so dangerous. The harm doesn't announce itself in advance. You don't hear an alarm. You don't see a flashing warning light. You simply feel fine when you swallow the pill. Then hours later you stand up, your pressure drops, your brain gets less blood for a few seconds, and suddenly you are on the floor wondering what happened. I'm Dr. James Hargrove. I've practiced internal medicine for over 30 years, and today I'm going to give you something most doctors don't have time to explain in a 15-minute office visit. Before we go deeper, drop the city you're watching from in the comments. I read every one, and it helps me see who is part of this community. Now let me tell you why bedtime can be so dangerous. Your blood pressure is not fixed. It is not one number you carry around all day like your shoe size. It rises and falls constantly. It changes when you wake up, when you move, when you eat, when you stand up, and especially when you sleep. Most healthy people experience a normal dip in blood pressure overnight. That is expected. That is physiologic. But in some seniors, if your medication is timed in a way that intensifies that natural overnight drop, your blood pressure can fall lower than your brain and body tolerate comfortably. That's when dizziness, fainting, blurred vision, and falls start entering the picture. There are 3 specific reasons bedtime is risky for seniors. Reason number 1, orthostatic hypotension. That's the medical term for blood pressure that drops when you stand up. As we age, the body's pressure correction system slows down. Blood pools in your legs and abdomen when you stand. Sensors that should signal the heart and blood vessels to compensate respond more slowly. Add a medication that's peaking overnight. Add a little dehydration from a warm bedroom. Add the speed of getting out of bed at 2 a.m. to use the bathroom, and that pressure drop can be dramatic. In an older adult, fainting doesn't just mean embarrassment. It can mean fractures, head injury, and a permanent loss of confidence. Reason number 2, diuretics. Water pills are designed to help your body shed salt and fluid. That means more urination. If you take a diuretic too late in the day, especially right before bed, you are essentially scheduling nighttime bathroom trips. Combine those trips with poor lighting, slower reflexes, arthritis, neuropathy in the feet, maybe a little grogginess from sleep, and a medication that helps your blood pressure during the day is suddenly increasing your fall risk overnight. Repeated nighttime urination can also disrupt sleep, worsen daytime fatigue, and contribute to dehydration, which makes low blood pressure even more likely the next morning. Reason number 3, the missed dose trap. Harold was 71. Sometimes he forgot his morning pill. When that happened, he would take it at bedtime instead, then take the next dose again the following morning because he didn't want to get off schedule. He wasn't trying to overdose, he was trying to be responsible. But what he accidentally created was a compressed dosing interval. 2 doses too close together is one of the fastest ways to cause unexplained dizziness, dangerously low readings, or fainting in seniors. The dangerous time isn't just bedtime. It's bedtime after a forgotten daytime dose, when you're improvising without guidance. Now let me give you the 5 specific scenarios where bedtime dosing becomes most dangerous. If even one of these applies to you, talk to your doctor before your next pill. Scenario 1. You take a diuretic. If your medication causes you to urinate more, taking it at bedtime almost guarantees nighttime bathroom trips. That's not just inconvenient, it's the leading recipe for nighttime falls in seniors. Scenario 2. You've ever felt dizzy when standing up? If you've noticed a wave of lightheadedness when you rise from a chair or get out of bed, your body is already signaling it can't compensate fast. Bedtime medication intensifies that overnight. Scenario 3. You wake up at night to urinate even once or twice. The dark hallway, the warm bed to cold floor temperature shock, the half-sleep balance. Every one of those trips becomes more dangerous when your blood pressure is at its lowest. Scenario 4. You've had a fall, near fall, or fainting episode in the last 6 months. One fall in a senior is the strongest predictor of a second. If you've fallen and you take BP medication at bedtime, that schedule deserves immediate review with your doctor. Scenario 5. You live alone. Nighttime events are especially dangerous when nobody is there to help. A minor episode of faintness can become hours on the floor. A bathroom trip can become an ambulance call. If you live alone, your medication timing has to be reviewed with extra care. Type the number 5 in the comments if you live alone. I want to know how many of you this applies to. Let me show you how this plays out in real life. Frank was 72, a retired bus driver with high blood pressure and mild leg swelling. His doctor had him on a water pill plus a second blood pressure medication, both in the morning. Frank heard from a relative that taking BP meds at night was better for the heart. So he moved everything to 9:30 p.m. He thought he was doing himself a favor, trying to be smarter than before. Within a week, he was up 3, 4, sometimes 5 times a night urinating. He was exhausted during the day. His mouth was dry every morning. He felt shaky when he stood up. One night, he nearly tripped over the edge of a rug while rushing to the bathroom. He didn't realize his healthy bedtime routine had become a setup. Frank was lucky. He didn't fall. But the risk had been creeping higher every single night for 2 weeks before anyone caught it. So if bedtime is the dangerous time, what time is safer? For many adults over 60, especially if any of those 5 scenarios I just gave you applies to you, morning dosing tends to be safer. Here's why. Your blood pressure is naturally highest in the morning, especially the early surge between 5 a.m. and 8 a.m. A morning pill addresses that peak. Your body has all day to circulate and clear the medication before the natural overnight dipping period. If the medication causes urination, you're awake and active to handle it. If it causes lightheadedness, you have daylight, balance, and reflexes to compensate. But, and this is critical, there is no universal time that's right for everyone. Some seniors do better with evening dosing because their morning blood pressure surges hard and they have no fall risk factors. The right schedule depends on your pattern, your medications, your fall risk, your physiology. The point is not always take it in the morning. The point is, bedtime is the most dangerous time when timing has not been individualized, when you're already prone to dizziness or nighttime trips, or when the medication itself creates overnight risk. Let me tell you about Robert. Robert was 73. His office blood pressure readings looked acceptable, but he complained of morning headaches and nighttime wooziness. His case made no sense until he underwent round-the-clock blood pressure monitoring. That revealed the truth. His pressure dipped excessively overnight, then surged sharply right before waking. If someone had just guessed and pushed more bedtime medication, he might have become even more unstable. Instead, his doctor adjusted his regimen carefully, not dramatically, and his symptoms improved. The point of Robert's story is this. The body's 24-hour pattern can surprise you. What looks obvious from one office reading may be completely wrong across a full day. You cannot determine the safest medication timing from the internet alone. You can learn principles, You can learn warning signs. You can learn what questions to ask. But you cannot know your safest schedule from a headline or a friend's experience. That's why I'm going to give you something practical you can take to your doctor next visit. 5 specific questions. Write them down. Put them in your phone. Bring them. Question 1. Given my medications, my fall risk, and my age, what is the safest time of day for me to take this pill? Question 2. If I take a diuretic, what time should I be taking it? And is that schedule still right for me as I get older? Question 3. Have you checked my standing blood pressure, not just my sitting reading? Because if there's a big drop when I stand, that changes everything about my timing. Question 4. What specific symptoms should make me call you immediately? Be specific. Dizziness on standing, near falls, morning weakness, fainting. Question 5. If I forget a daytime dose, what's your plan for me? Because making it up at bedtime is one of the most dangerous things a senior can do without guidance. Any good doctor will welcome those 5 questions. They tell your doctor you're paying attention, you take your health seriously, and you want to be a partner in your care. If your doctor brushes off these questions or makes you feel difficult for asking them, that is important information about whether you're with the right doctor. Let me tell you how this story can end well. Marion was 78, active, thoughtful, and increasingly anxious because she kept feeling unsteady in the mornings. She assumed it was age. Her daughter assumed it was poor sleep. Her neighbor told her she should be grateful her blood pressure was nice and low. But Marion paid attention. She started writing down exactly when the dizziness happened. She noticed it was worse between 5 a.m. and 8 a.m., and, especially after nighttime bathroom trips, she brought that note to her doctor. Her doctor reviewed her schedule, moved one medication earlier, kept another where it was, and adjusted her diuretic. Within days, the morning fog lifted. The dizziness eased. The fear disappeared. Same woman, different timing, safer life. That is why this matters so much. Timing errors are sneaky. They don't look dramatic. They look organized. They look healthy. A senior says, I take my medication every night like I'm supposed to, and everyone nods approvingly. But if that timing is wrong for that person, the routine isn't protecting them. It's putting them at risk. And the tragedy is that many seniors blame themselves for the consequences. They think, I'm just getting weaker. I'm just aging. No. Sometimes the body is responding exactly as physiology predicts. The schedule is the problem. So here is what to do tonight. Don't change your medication based on this video. Use it as a reason to act. 1. Make a complete list of every blood pressure or heart medication you take and the exact time you take each one. 2. For the next 2 weeks, write down any dizziness, weakness, near falls, or unusual nighttime bathroom trips and what time they happened. 3. Bring that list and that diary to your doctor or pharmacist and ask the 5 questions I just gave you. If you take a diuretic at bedtime and you're waking up multiple times to urinate, call your doctor this week. Don't wait. If you've had a fall, near fall, or fainting episode in the last 6 months and you take any blood pressure medication, call your doctor this week. If you live alone and you take a bedtime BP pill, that conversation matters even more, because nighttime events without help can turn small problems into emergencies. After 30 years of practice, here is what I tell my own patients. Your medication should work for you, not against you. Your blood pressure plan should protect your heart without endangering your balance. And you deserve a routine that keeps you safe in the daylight and in the dark. If this gave you new information you can use, please share this video with someone you love who takes blood pressure medication. Send it to your spouse, your sibling, your parent, your neighbor. One conversation, one schedule change, one question asked at the right doctor's visit. That can be the difference between a stable morning and a fall that changes everything. If you want more practical, evidence-based health guidance for life after 60, hit subscribe. New videos every week. Drop a comment below. When do you take your blood pressure medication? Morning or night? I read every comment and reply to as many as I can. Take care of yourselves. I'll see you in the next one.